About 30% of Salina County has been vaccinated. Access to the COVID vaccine has been opened wide, and I encourage you to go get one. This is Dr. Rob Freeliff, Chief Medical Officer and Senior Vice President of Salina Regional Health Center.
Dr. Freeliff, thank you so much for being on the show. We're going to be talking about vaccine hesitancy, and where we're at in Salina County with vaccines. So let's start out with that.
Sure. Well, the vaccines are much more readily available in Salina County than they originally were earlier this year.
Okay.
We've been giving vaccines at the former J.C. Penney building in collaboration with Salina Family Health Care and the Health Department. But now they're pretty widely available. You can get them at most pharmacies in town. They may not have them every day, but you can go on to vaccinefinder.org. It's a website, and put in your zip code, and it'll tell you anywhere that you could potentially get the vaccine within that zip code or within X number of miles of that zip code. But yeah, you can get them. They're pretty widely available. We're actually giving some through our ComCare and urgent care locations as well. We're up to 17,000 people in Salina County that have gotten the vaccine at one place or another. Some of that's 2 doses, some of that's 1 dose. So, about not quite a third. We're right around 30% of the county has received at least 1 vaccine, if not both doses of the 2 dose, which that's a pretty good start. I'd sure like for it to get higher. We'd love to see that number, certainly above 50% and as close to 70 or even 80% as we can possibly get it. Right now, the vaccine is limited. You can only go down to age 16 with Pfizer, and the other, Moderna and Johnson & Johnson, are only approved for 18 and above. So there's a certain portion of Salina County we're just not going to be able to get because it's not approved for them yet. But the more we can get, the better. And I'm pleased to say that, in particular among the older population, the uptake rate has been really pretty good. We're close to 70-80% of Salina County residents who are 65 and above, I believe, have gotten a vaccine. So that's great. They're the people who are at the highest risk of developing severe disease and being hospitalized and dying. So it's good to see that population getting the vaccine and taking it in such high percentages.
Doctor, why do you think people are hesitant to get the vaccine?
Well, I think most of it is there's been a lot of misinformation out there on the internet and social media sites about the vaccine. A lot of people question the safety, and it's a very safe vaccine. There's myths about it affecting fertility. There's no evidence that it has any impact on fertility, that it causes infertility or anything like that. It's something that was developed rather quickly, and I think that gives people some pause.
Right.
But the science behind the vaccines has been there for a long time, which allowed them to be developed and released so quickly. And a lot of that is red tape that was kind of just slashed through, not rushed, but there were certain things that, instead of waiting 2 months for a meeting, we're going to meet tomorrow and talk about it. And so there's good data behind the vaccines. They're safe, they're effective. I think just a lot of people have been misinformed about that.
Okay. Well, obviously, protection from COVID is the most important reason, but let's talk about some of the other benefits for being vaccinated.
Yeah, sure. Probably one of the biggest is what you and I are doing right now. We're not wearing our masks. We're both fully vaccinated. If you're in small gatherings and everybody is fully vaccinated, you don't have to wear a mask. And actually, in private settings, if you're fully vaccinated, you can be in a household where just one household isn't completely vaccinated. As long as there's nobody at high risk of severe disease or death from complications of COVID, you wouldn't have to wear masks in that as well. So still have to wear them in public, still recommended wearing them in medium or large size gatherings. But it's nice, we have friends who are fully vaccinated, and it's nice to be able to gather with them and take off your mask to sit down and eat a meal, and then not have to rush to put it back on.
I think as well as being exposed to somebody who has COVID as well, the quarantine rules are different.
Yeah,
correct?
And that's a big one. The quarantine rules are different. If you are fully vaccinated and you're exposed to somebody who has COVID, you don't have to self-quarantine like before. Before you had to self-quarantine or quarantine for 10 to 14 days until you could kind of go back out in public. And now if you're fully vaccinated, you can keep doing you can go to your job, do those kind of things, grocery shop, all that stuff. You just have to monitor for symptoms. Now, if you develop symptoms, then you need to quarantine and get tested. But if you don't develop symptoms, you're good to go. The other one is travel. That's another big one. The CDC right now is saying that if you're fully vaccinated, you can travel domestically and not have to worry about it. On the backside, that self-quarantine, there's some destinations where you go, if you're there and you're not vaccinated, when you come back, you're supposed to quarantine for 10 to 14 days.
Right.
If you're fully vaccinated, you come back, you just keep on living. So that's a big deal. The quarantine has been as disabling from a society standpoint as the disease.
Right.
When you're talking about workforce and you get one person who has it is out 14 days, but there's 5 people that work near them, they're also out 14 days. That's a lot of man hours lost.
Right. Okay. Thank you so much for being on the show. And thank you for watching. To find a location to get your vaccine, please visit vaccinefinder.org.